In order to prevent any more children from falling ill with this dangerous disease, I am today declaring a countywide state of emergency. Effective at the stroke of midnight tonight, March 27th, anyone who is under 18 years of age and is unvaccinated against the measles will be barred from public places until the declaration expires in 30 days or until they receive at least their first shot of MMR.
Measles is a big public health concern because it's so highly contagious, one of the most contagious diseases that we know to exist. This virus, if you go into a room with 100 people who don't have the vaccine, with one person who comes in with measles, 90 of them will end up infected.
So we are in our 7th month of the measles outbreak. It began in early October with cases that generated from visits to Israel. It then expanded to what we now have as 166 cases. We have, over these months, worked in the community with our with rabbis, with our school administrators, with pediatricians and other health professionals. The epicenter of the disease, because it's in our Spring Valley, Muncie, and New Square community for the most part. This was a population that has historically not been high on the vaccination list. Their rate was known to be about 66%, as far as the pediatric population is concerned.
I do not agree with the judge's opinion that the measles crisis does not rise to the level of an emergency. That is just not accurate. To be clear and unambiguous, the Commissioner's orders issued in December of last year still stand. These orders require any school with less than a 95% vaccination rate to keep unvaccinated students home. Schools must continue to comply or they will face significant fines.
So at this time, the schools are still required to maintain that the students who are not immune or under-immune or not immunized remain out of school if they have less than 95%.
Since this outbreak began, we have seen an increased number of vaccinations, a lot more interest in knowing whether or not their children are up to date in accordance to what the measles vaccines guidance is. And if they're not, we have seen people who are on the fence who now, with a lot more cases happening every week, and according to the DOH advice and according to the Rockland County legislators' advice, much more interested in getting that vaccine that they might have been on the fence about prior to this.
There are, parents that are worried to bring kids to birthday parties. They don't know if there had been someone there who had the measles 2 hours prior to them being there, because it can still be contagious. So it can affect daily living, going to the supermarket, going to bigger stores, or places of entertainment like movie theaters and things like that. So we do notice that the parents do seem a little bit more hesitant to do daily activities with the kids. So a lot of them have been trying to keep the kids at home.
It's not just MMR vaccine that parents have hesitancy about. It's all the vaccines for some of these parents. But the number one cause of hesitancy on vaccines is absolutely MMR. Out of all the vaccines, it gets the most flack, the most, if you Google search, you're going to see everything about MMR causing autism, allegedly, and all these other things that are just been proven untrue, study after study. So undoing the public opinion when people go to Google to search for their health information and facts, and undoing all of that with a simple conversation we try to have in the office with the parents is a really, uphill task. Luckily, with most of our patients, they do take our word over that of Google.
The problem that we have is that there are many unreported cases. People in the community, and by this I do mean mostly the religious community, have not necessarily even been going to visit their physicians or other providers who need to report measles, and they know that. The number is difficult to determine, but with our 166 cases, I can say safely that there are many, many, many more that go unreported. And the problem with that is that we don't find out about them in a timely manner, if we ever find out about them. And therefore, it's more difficult to contain this because they're spreading they're continuing to spread. And maybe now they're not spreading as much in school if they're truly excluded, but they still get together for different events. We have, we just had Purim, Passover is coming, Easter's coming, family gathering times, which we also saw this occur in the fall, with Rosh Hashanah and Yom Kippur.
I think the county executive went to great lengths to say this is about health, and it's about everybody's health, and making sure that no one would mistake this as a reason to target any particular people or community. And that was always our concern, that there is an issue at times in Rockland County with anti-Semitism. And we were concerned about that some people would use this state of emergency as an excuse to target members of the Jewish community. And I don't think that's happened.
I wouldn't call it a canard, but it get close to it. It's an unfair canard, or it's an unfair assumption that the Jewish community is opposed to vaccinations. The Jewish community, the Jewish heritage, is one that really embraces health and safety, and the fact that there are a few people on the fringe that make their personal choices and hurt or put other people at risk shouldn't be one that is imposed upon a whole community, because it's really not.
There have been certain limited instances, which we have heard of, where in certain public places, people have come up and said, are you vaccinated, or you're not vaccinated? We've heard this particularly at some schools going on. But it's been limited in number. It has not been hugely widespread that I'm aware of.
I'm an Orthodox rabbi, and the overwhelming majority of Orthodox rabbis tell their congregants to get the vaccinations for their children. And any type of desire to sort of whitewash the situation and say it's a Jewish problem or a Hasidic problem is really a misnomer. It's a problem because of people on the fringes who haven't vaccinated, and so the other people are being affected by it, not only physically with the potential of disease, but also by really having their reputations hurt by a few people who have made a personal choice which is really contrary to Jewish law.
In the year 2000, we were able to say there's no more endemic cases of measles in the United States of America. And now to be sitting here in Rockland County in our backyard and have a measles outbreak, it's a real shame, to be honest, that more people don't understand how important it is. If your child doesn't have any contraindications, they should be vaccinated with the measles vaccine.
As physicians, and for other healthcare providers, we have a scientific basis to what we're taught, what we've learned, and what we do. You always find some that have their own personal opinions, but truly, when you learn about them, they're not scientifically based. And I think our role is to remind those who are hesitant to receive vaccines, for parents of children, that the science shows that the vaccines save lives. Prevention is critical. And that's the message that we need to give them.
I asked the judge or any other rational person, how high must our case count be before you will consider an emergency? 85% of these cases have been our children. I refuse to sit idly by while those in Rockland are put at risk, as my highest responsibility is the well-being of the people here. It is completely within my powers, granted in the New York State Executive Law 24, to determine what is and what is not an emergency.